Hi guys, welcome back again to my channel. A lot of times I get asked, how do you love your job? Like, do you think nursing is worth it? And I just want to freestyle this talk and see, share how I've been feeling about nursing so far. I've been nursing for almost 3 years now, and I would say that it's been a rewarding and yet stressful and challenging journey, to be very honest. But I would definitely say that it is worth it. That would be my first goal to answer. It is worth it. I've been on a medicine unit. I also work labor delivery, so I've been in two different places, and I've been places where they've done time of death and they've done time of birth. It is interesting to be able to go through people's trajectory and people's journey and help them through their life. That's definitely one thing that I appreciate about this job, is to be able to journey with people through important moments in their life, through birthing a baby, which has different stories attached to it, or through the time when their loved one is passing away or their loved one is really sick, and being able to nurse them back to get out and be there for the family, be there for the patients. It's also rewarding in some way for me, because just to be able to see that you make that difference, in some way, especially when you get feedback and they're like, thank you, your care was superb, you helped me, you guided me, you did this, you did that. It's always nice to get that kind of feedback. So that's one thing that I appreciate about the job, just being able to work with people through the health journey, nurse them back to good health, or even if they're dying and passing away, being able to be there and just provide comfort in some way that you can, as they pass on to the next life or eternity. So yeah, that's that. Number one. Number two part of the job is actually being able to see how different parts of people's life affect their health. So how you learn social determinants of health, so like where the person grew up, the environment they grew up in, and a couple other social determinants. So just being able to see how that works into the holistic health picture, so versus just dealing with the person like, this is just your problem, we're just going to give you medication and go. You're trying to, as a nurse, you're like interacting with all these different components and saying, okay, how can we mitigate here and here to make sure that you're not coming back, or there's not a repeat of this health issue. So being able to sort of brainstorm on that is also a nice thing. I also like that it improves your critical thinking. So when you're with your patients, you're like, okay, this is what they're coming in with, and I'll bring from both a medicine and a labor and delivery perspective. So from a medicine perspective, you're saying, okay, they're coming in with maybe edema, so they're swollen, and you're like, what else could be going on? I'm giving them Lasix, they're not reducing, their legs are still swollen, they still have all the symptoms. What else can I be doing? What else can I be thinking about? And you're like digging deep and trying to connect dots here and there, and being able to sort of be the eyes and the ears of the doctors and be like, okay, this is what I'm feeling, this is how I'm interpreting this. Or like if you're in a labor and delivery unit and you're like, maybe this medication is, maybe they're diabetic, and you're like, yeah, let's get them started on this, but you're saying, okay, maybe we should take a pause and actually approach it this way. It just boosts your critical thinking, because then you're not just focused on just this is how it goes textbook, where you're saying what else could be a contributing piece. And then by the time you've done it over and over again and you get new patients, you are actually now thinking about the clinical big picture and not just the myopic or the small pieces of it, but saying how does this all integrate into the overall health of this person. So it definitely has built my critical thinking. I think that has even spilled over to other parts of my life as well. It's definitely also made me more like, when I see people, I can like literally just assess and be like, you're breathing differently, you're breathing too fast. Like it's almost like I'm listening to how they're breathing, which I don't even know how that happens, but I'm like, okay, are you okay? Or noticing quickly like, oh, there's a mark on the neck, or there's a mark on the this. It's just very weird, but I guess your instincts are a little bit sharper, like, because when you get into somebody's room, you're like trying to do an assessment right away. So you're talking to them, you're like listening for certain things, even though it just looks like you're talking to them, but you're basically doing like an assessment. So so that's it. So yeah, Also, so let's talk about the 12-hour shifts, because that's also something that is very stressful about the job. I'll be honest. 12-hour shifts are a lot. I do like that you can get, breaks in between, like in terms of like, so if you work maybe 3 shifts back to back, then you get 2 days off in between the week. Like, you don't have to wait for the weekend. That's something that I like, and that you can have your day to yourself. But if there was programs in the evening, if there were like things I had to go for later in the evening on that day, it would be so hard to catch up. And even if you do go, you're just very exhausted that you cannot almost be mentally present. There are days that your work is so mentally exhausting, which is another con sometimes. Like if you have like family that you have to be present for, and you want to build and you want to be there for your kids, sometimes it might be challenging to be able to fit that, except maybe you still have a partner who's very supportive and you guys can work around it. But sometimes it's just really hard to be able to flow with your 12-hour shift and being able to be there for, like, if you had young kids. So that's one of the things that you consider. But again, there's also options to do like 8-hour shifts, work in a less stressful place, if that's an ongoing issue, because you can always move with nursing. You don't have to stay stuck somewhere. So yeah, that's one thing. I guess just off the back of that would be the flexibility in being able to move is something that I appreciate about nursing. You don't have to go back to school for like 4 years to be able to change units. If you're like, okay, labor delivery isn't working for me, I want to try something else, you can go into surgery, apply for that. They'll do like an orientation, get you on board. So it's not like you really have to. There's some courses that there's some units that you might need to take like a 6-month course or a 1-year course, say maybe like the OR or critical care, but like it's not like you have to go back for another 4 years to do a master's, especially except if you want to go into like in-depth teaching and stuff. So I think there's a lot of flexibility and room for, changing jobs and exploring until you get the right fit for you. That's something that I really appreciate about nursing as well. Cons is just the added stress that you can really take, honestly. So it's important to take time to care for yourself, to just unplug, if you need a mental health day, to do that as well. Sometimes you might also need to speak to a counselor, especially if you've had stressful events back to back, because you don't even realize how that, piles on and piles on and piles on and piles on you as an individual. So it's important to be able to check yourself and find those outlets where you're spending time with family and friends, and also even have a nursing friend that you can rant to who gets the intricacies of the job, because it's a little hard to explain to people about how it works sometimes in the hospital. It can be hard if they don't get it. So it's nice to have that person or those people, your nursing friends, who you can actually say, hey, this is what happened, oh my gosh, and they can be like, yeah, I get you, I really, really get you. So that's it. I'm trying to see if there's any other pros and cons with it. At the end of the day though, school is crazy. Like, I don't even miss nursing school, I'll be honest. I thought that was really, really brutal, but it helped though, because like, even though I'm not consciously thinking about it, I know that I'm integrating nursing care plans into things. I know that I'm integrating nursing diagnosis and priority assessment into what I'm doing when I'm going into patient's room after receiving reports. I know that I'm doing that just because, with time, with practice, you get there. But just the work that you had to do in school, I just like, staying up to 2 a.m. to be able to come to clinicals at 6. It was a whole lot of work, to be very honest. And I don't know if I'm sure there's ways that it can definitely juggle this workload, like to make it even more bearable for students. But anyway, I don't miss nursing school, as you can tell. So yeah, there are definitely opportunities for growth, the opportunities to explore, the opportunities to find your right fit. Even though we can be very stressful, because also even with the stress part is dealing with people. You're dealing with people who have attitudes. You're dealing with people who are the nicest and the sweetest, and make your job easy, and just are very just, you just want to be there because you can tell that they appreciate you. And there's some that are just straight out mean, maybe have things going on at home for them, and it's just, that's also adding to your stress. And sometimes also you're short-staffed and your workload increases, and they don't, those days don't go well, because you can totally feel that you're just like, I'm over it. So it's this job can be stressful, but if it is something that you're interested in, I would say it's definitely worth it, especially if you really care for people, and feedback like, hey, thank you for caring for me, thank you for making that difference in my life, means a lot to you. You would enjoy the job, you would like it. So yeah, that's my spiel for this video, which was just kind of like, how am I doing with nursing so far in this week, just touch base. I have a video on my other channel which is about 5 good ideas for your nursing friend or your nursing relative, so go check that out as well. I will talk to you guys later. Take care, bye. Don't forget to hit the subscribe button. See you in my next video.